Welcome to this iWorld live event. I'm here with Marjan Farid. I always learn new and exciting things from you. Marjan, there's been lots of conversation over the course of the last several years about the superiority of DALK as a procedure. The adoption has lagged, and the reason, correct me if I'm wrong, that it's lagged is because DALK is hard to do.
Yeah.
So, and that the learning curve is it's frightening. So you have developed a way that makes the learning curve a lot lower altitude and makes the procedure more reproducible. Am I correct about that?
We're working on developing this technology, absolutely. So you're absolutely right. DALK was first introduced to us over a decade ago by Dr. Agarwal, who introduced the big bubble DALK technique, which really was a huge innovation in corneal disease because now all anterior corneal disease could be treated with a procedure that was extraocular. We're not going into the anterior chamber, making the safety better. Risk of endothelial rejection went to nil, essentially. So a fantastic technology. But despite that, the uptake has been very poor, as you mentioned. And a big part is it's hard to achieve a big bubble reproducibly every single time. And it can certainly take up more OR time as well. So our failure rate of achieving a big bubble, even in experienced hands, who physicians who are doing DALK all the time, is still 30 to 50%. And so a lot of times physicians are ending up converting to a full thickness keratoplasty. What we're trying to do is use the femtosecond laser as an innovation. We've been using femtosecond laser technology for full thickness transplants, as well as what we call femto big bubble DALK. But we want to further look into modifying settings of the femtosecond laser to be able to make a very smooth, reproducible, deep corneal cut, full thickness, where the cut is so smooth that you really can forego making a big bubble, and that the smoothness of the posterior cornea and the thinness that is residual will be good enough to give you very good optical quality, and can be achieved by essentially any corneal surgeon, regardless of how much experience they have with DALK.
Oh, really, really interesting. And of course, we gather OCT data from the femtosecond laser anytime that we do, femtosecond cataract surgery.
Correct.
So there's certainly the facility to develop that sort of treatment profile. The thing is that you can get a plane that is very smooth. I assume you tweak
Yeah.
your parameters, but that plane is going to cut through cells. It's not going to be separating the lamellae. What does that mean in terms of the way that these patients heal?
So we're cutting through stromal cells, essentially, but it's deep in the stroma. And the reason we haven't been able to do this in the past, and we've tried, is because the femtosecond laser technology, for example, that makes our anterior flaps, for example, LASIK, uses high energy. But because the anterior cornea biomechanics are very different from the way the collagen fibers are laid down in the posterior cornea, you can reproduce a smooth cut in the anterior, but we haven't been able to do that in the posterior cornea. Now, with newer femto laser technologies where you can adjust the laser energy setting way low and bring the spot separation size way down so that the spot sizes are very close together, you can really create a very smooth bed. And it's safe to the endothelial cells. The toxicity to the endothelial cells is zero, essentially, because we're using such low energy. And so only with sort of the modern femtosecond lasers, specifically I've done this in the lab with the Visumax laser that is Zeiss laser, and it's able to make a very, very smooth pass in that deep cornea, which we haven't been able to achieve in the past.
Now, granted, this technology is not polished to the point that it has to be in order to be adopted clinically. So what I'm going to ask next isn't fair. But it's not going to stop me. How long does one of these treatments take? I mean, are you stepping on the pedal for 10 minutes here?
Seconds. Literally, you can make a smooth pass in like 15 seconds, essentially. It's a very smooth, it's the same laser that does the SMILE procedure. And so it's very exact down to the micron level. And it's within seconds. So it's actually very comfortable because the cornea is not applanated completely flat. It's a curved corneal interface. And so it's comfortable and it's fast. And we think it's going to be optically feasible for patients that need DALK. So our next phase is moving into human trials then. So we've been able to achieve it in the lab. The cuts look very smooth. There's no endothelial toxicity, and now we really need to move it to the next stage.
Marjan, this sounds absolutely wonderful. How far are we? And I know you can't possibly know what the answer to this question is. That's also not going to stop me. How far are we until we have something like this clinically?
I think it's essentially at our doorstep now. I think it can be done. It's a matter of getting a laser into our hands and taking the plunge and doing it on a patient, which is, so I think we're very close to actually making this available. What we really need, I think, is advocacy to help make these lasers accessible to corneal surgeons, because right now part of the issue is accessibility, cost, and I think the future of keratoplasty in general is going to be femtosecond laser. We have better wound incisions and now better deep cuts. So we need to push the boundaries, and just like every cataract surgeon or most high volume cataract surgeons have a femtosecond laser, corneal surgeons need to have a femtosecond laser for keratoplasty.
Yeah, interesting. Really, really interesting. And I would guess, of course, this isn't something that we can know yet, but I would guess that this sort of technology would decrease the difference between experienced surgeons and surgeons new to the technology, because the laser's doing the hard part, really.
Exactly.
Yeah, Marjan, this is wonderful, wonderful stuff. I want to thank you for bringing really this good news to us, and for making this the case for this new technology.
Absolutely.
And I want to thank you, our viewing audience, for participating in this live event. I know that you'll agree with me that Marjan was more than worth your time. And tell your friends about iWorld Live.
Thank you.